Today we are going to be discussing the basics of care coordination in healthcare. The reason for our discussion is um, a lot of times um, while working in healthcare, patients and family members need their core care coordinated to prevent rehospitalization rates, to increase patient care, and to have a better quality of life while providing care for their disease processes on an outpatient basis. So, today we are going to be discussing how outpatient care can help and assist with um, better coordination inpatient. Um, so basically, understanding our patient's needs, disease process, and continued education are important parts of continuum of care in the healthcare setting. Care coordination can be affected by a multitude of different reasons that are included but not limited to ethical reasons, policy factors, cultural needs, emotional or physical needs. Today we will be discussing how to better approach care coordination and the basics of coordinating care to better understand our patients and their needs. In this next portion, we are going to discuss effective strategies for patient care collaboration. Care coordination is care that is communicated between a range of healthcare providers. Care coordination should include effective communication, effective care plan treatments, and clear and simple instructions to the patient. However, many times patients are being discharged without adequate instructions and subsequently are readmitted to the hospital, which in turn can cost the hospital upwards of millions of dollars, secondary to unnecessary readmission rates. Effective strategies to assist with streamlining care coordination can include a few approaches that I have done some researches on. The first one is called the guided primary care approach. Utilizing this approach, an experienced registered nurse who works with patients who have multiple chronic comorbidities provides an assessment and then works collaboratively with the primary care physicians to develop a plan of care suitable for the patient to follow. So essentially, a nurse is following up and developing the needs of the patient. Once this has been established, they discuss with the primary care the best course of action. They develop an entire care plan that's easy for the patient to follow. The patient goes home, follows this care plan, can call and discuss with the nurse any questions that they may have had. Um, in a recent study, utilizing this approach has cut healthcare costs by 11% with an annual savings of $1,364 per patient. The second one we are going to discuss is called acute care coordination. This type of coordination continues on the patient has been treated for this emergency and is now discharged from the hospital. And this type of communication um, process, these coordinators schedule follow-up visits, they make sure prescriptions are obtained and filled, and also reviewing discharge instructions with the patient and the family. Our goal is to decrease ER visits and decrease preventable hospital readmission rates. And then the third one we are going to talk about is long-term care coordination. This type of care coordination exists in long-term care facilities or assisted living facilities. In this type of care coordination, social workers involve work with the family to ensure they understand the expectations of living in assisted living facilities. They also provide family support and referrals made to specific support services or community resources if warranted or needed to provide additional support. Um, so those are the three main care coordination techniques that we could utilize to help decrease and help promote good patient care and prevent rehospitalizations rates. The next thing we are going to be discussing is identifying change management that affects patient experience. Oftentimes, we become so involved in our task at hand that we tend to forget how much discharge planning and education can play a role in hospital readmission rates and continued emergency room visits. For example, in a recent study performed, one-third of patients have a medication discrepancy upon hospital discharge, and 1 in 5 developed an adverse effect within those weeks after leaving the hospital. 1 in 5 people are not properly getting the education that they need or deserve when they leave the hospital. So, what this is saying is that essentially discharge planning needs to start and begin at admission. We need to start educating these patients sooner and getting them to understand their disease process and trying to spend more time with them. I think it would be beneficial if there was a care coordinator or discharge planner or discharge coordinator that could assist the nurses in helping to facilitate this program. Implementing a program where the cost may be higher in the beginning can reduce costs in the long run. For example, sending someone home with home health instead of a skilled nursing facility could potentially create a readmission rate. In addition, being able to measure the financial and clinical aspects of providing care will help the practitioners when applying care coordination in the future. Implementing consistent and effective care coordination strategies starting at the time of admission and follow up through to the healthcare providers and primary care appointments can help us decrease the patient's need for continued emergency room visits, and the patient will know how to manage the disease process better without the use of continued hospitalizations. Coordinated care plans are necessary to improve patient care and patient outcomes. Coordination should be considered when patient is admitted to the hospital and how to achieve goals for success. If facilities could implement appropriate coordination plans and resources, this could be utilized to improve patient outcomes, reduce unnecessary readmission rates, and assist with boosting reimbursement rates. However, according to a recent study, approximately only 7% state that their facility is fully coordinated. In theory, if a person's care is not fully coordinated, then patients suffer. For example, if a physician doesn't know your correct history, your correct medications, and even correct physician in your care, then sometimes the treatment plan might be insufficient, secondary to insufficient data at hand. As mentioned previously, inappropriate care plans can have major consequences, and the most being inefficient patient care. For example, improving patient care by developing care coordination could reduce hospitalization rates, keep the patient home longer with his family and friends. This could potentially be a positive potential impact, with care coordination coming together to reduce readmission rates and increase reimbursement rates. Not all impacts with care coordination creates a positive effect. Without care coordination, we could potentially be looking at decreased patient care, patient outcomes, adverse effects, and potentially death if not coordinated properly. For example, without all the unnecessary information regarding patients, physicians might not be treating patients appropriately that could ultimately end with an adverse reaction. The last thing we are going to be discussing today is how we can raise awareness for this problem. So, unless you're completely educated on the positive aspects of care coordination, not all facilities and/or nurses might be knowledgeable on what care coordination can do to improve patient care outcomes and reduce admission rates for overall long-term benefits. So, my suggestion would be to